important thing in a medical practice so that you can do a justice to your talent and to the patient. So there are two aspects of assessing unsuitability of situation from patient point of view and from surgeon's point of view. Looking at patient point of view, heard Dr. Partha talking in all great details. Patient wanting a spectacle independence, which is, I think, considered as one of the important points. Second will be a perfect vision in terms of quality wise, and the lifelong suitability remaining the advantage for a lifelong patient. And the most important factor will be affordability. There are certain situations when patient is fit for a multifocal IOLs, but the cost may not give him that advantage. That also has to be looked after by both the patient party, the insurance companies, the manufacturers, and surgeon's point of view also. We are looking for a patient profile, the requirement for a patient point of view, distance, near, intermediate, or look for other types of important morphological features, that is type of cataract which you talk about, and other aberrometry profile like angle alpha, angle kappa, and the comorbidities which I'm going to talk about subsequently, patient undergone refractive surgery in the past, or any associated complication which may happen during a surgery which makes things absolutely unsuitable for our patients. This is what Dr. Partha also showed. We are looking for a newer generation trifocal lenses and the extended range of vision lenses. So these are two category of lenses which at present time is absolutely I think best for a patient. We need to select the patient carefully. The first part. Second part will be doing a good rexus for patient so that effective lens position, which is so important for a lens getting a proper position and giving an accurate result for what you have achieved in accurate biometry. So these three arms will actually give you a right direction for achieving good results for patient point of view. The third important thing is a counseling factor. In that, there are three categories of people. First, patient has a huge knowledge of intraocular lenses, come through a lot of literature reading. This patient may be difficult to counsel. Maybe you should try to reason out why he is not suitable for these lenses. Second category of patient does have some knowledge of intraocular lenses, but is amenable to your decision making. So he may be the best suited candidate for whichever lens he would be fitting to your profile or your patient's profile matching wise. Third category of patients are those who say, okay, doctor, you do an investigation, then let me know which will be the suitable IOL for me. And these are best candidates for our premium IOLs in future. Other is the patient lifestyle. I think this slide is very important for all of us to understand what all problems can be faced by us. Looking at the profession, today younger and younger people are getting cataract surgery done. Extensive night driving, a patient of a railway engine driver or a taxi driver may not be a good case for a multifocal IOLs. Patient retired elderly people, good case for a multifocal IOLs where they have a freedom for glasses which may be difficult at that age to handle. Very demanding professional patient, and maybe a surgeon himself or a patient who has work in like engineers, astronauts, maybe a monofocal lens may be suitable. Yes, today's scenario you might still put multifocal lens in these cases. Patient expectation wise, very highly demanding patient. Sometimes it will take a lot of chair time to convince him or deconvince him for these multifocal IOLs. This is other important factor, dry eye, which is so common nowadays in our population. Not only elderly patient, even the young patient have a significant dry eye nowadays. Good investigation to rule out dry eye, which may be mild, moderate. Severe cases, they are not suitable for a multifocal at all. Mild to moderate, you need to assess what is the type of dry eye they have. Treat those dry eye patients, do a biometry subsequently, and you get a good way of achieving good outcome with multifocal IOLs. So these are cases which may not be suitable for actual multifocal. Then type of cataract. You have a patient who has undergone refractive surgery, you have to assess them differently. Patient has a subluxation because of a pseudoexfoliation, because of myopic degeneration, may not be a good case for a long-term suitability and sustainability of capsular bag. Posterior polar cataracts with a pre-existing defect may not be a suitable. Otherwise, there will be a relative contraindication for these lenses. Posterior segment pathologies, As Dr. Partha talked about, every patient of cataract surgery should be undergoing the assessment of posterior segment, and OCT may be a part of your investigation, which will delineate all the problems which are not seen by most of anti-segment surgeons. You have a macular hole patient, ERM, or a patient having an edema in the macular areas. Very mild changes may be there sometimes, so you have to look, would that be a progressive disease for patient? Then judge your suitability. What about glaucoma? Because this is the age group, glaucoma, cataract, diabetes, all relate to the same age group. Advanced glaucoma, I think we should not using multifocal IOLs because of decreased contrast, and your field assessment may be sometimes difficult in these patients. Mild glaucoma, ocular hypertension, sometimes yes, you can do a good analysis in the future and take out the good results. Anisometropia, amblyopia may be a significant problem sometimes, especially if you look into this. One of my patients has a amblyopia in one eye, excellent difference of 1.5 millimeter. So these patients may not get a good adaptation subsequently with surgery and associated with high cylinder. So maybe you can go for a monofocal lens to begin with. Multifocal may not give you a good suitable result. Extremes of excellence, it may be myopic or hyperopic. This patient has excellence of 19 millimeter. The IOL requirement is plus 38 diopters. So you may not get a multifocal range in these cases. So always assess, that Dr. Ramamurthy talked about, difference in the two eyes. Extremes of excellence may not be good cases. Very high astigmatism, especially if you have variation in the reading of cylinder and power. Patient may have a corneal ectasia, early ectasia. These patients may not be suitable for your surgery. Post-refractive surgery, you have to analyze the entire abrometry profile of these patients. This is a patient had more than 32 incisions of radial keratotomies, and I had to take this patient for a monofocal lens only. Because if you see the corneal profile, very highly aberrated cornea with a huge higher order aberration and very, very flat keratometry. So these patients are never good cases for a multifocal IOLs. But this is a case which has a reasonably good corneal topography despite undergoing radial keratotomy and suitable for multifocal IOLs. So this gives the importance of not looking into a corneal lens, look for an entire aberration of eye and corneal aberration. That will give you a good analysis for your patient. Therefore, corneal wavefront analysis is a very good tool to decide which patient may not be suitable for your multifocal IOLs. Always look for a corneal higher order aberrations, trefoil, coma, which will guide you that this patient may not achieve good results. Angle alpha and kappa, though it is considered as a significant point, in my own practice there are so many other patients who have had a larger angle kappa, but they have done well also. So you have to take not single point, other points also to look into unsuitability for your patients. To summarize, I talked about patient profile, profession, requirements, then surgeon profile in terms of getting a good analysis of a patient's morphological features of cornea, cataract, the posterior segment, associated glaucoma, macular pathologies. Then decide what would be a suitable case for a multifocal IOL. But I would say just see that other way around, which are those cases which would not be unsuitable for your refractive cataract surgery. Cornea, ocular surface, glaucoma, posterior segment. If you look into these directions, the patient profile will get suitability or unsuitability for a multifocal IOL. Thank you for your kind listening.
Thank you, Professor TITIYAL. Wonderful warning and guidelines on whom to select and whom not to